Hi, welcome to my channel. I'm Will Kang, orthopedic surgeon. I'm here with Thomas Kang, a general surgeon and the program director at St. Agnes Hospital in Baltimore. He also happens to be my twin brother. Welcome to my show.
Thanks for having me. I'm dreading what's going to happen today.
Well, this is the first ever episode of a segment I'm going to call Hot Doctors, when I ask doctors questions over increasingly spicy pieces of chocolate. So how are you with spicy foods in general?
Honestly, I don't eat much spicy food.
Well, let's get started. We're going to take the first chocolate, which is labeled by Hot Monkey Bar as hot. Okay,
It's a little tingly.
a little spicy. All right,
It's pretty good.
what would you rather be? A chess international master or a Sifu in Kung Fu?
That's a hard one. I actually started taking Kung Fu lessons 2 years ago, and I'm pretty decent. I've been trying to learn chess since I was 14. That's a really hard one.
Well, which one is harder?
International master of chess is definitely harder.
Okay.
So yeah, I'd rather be an international master of chess.
When did all this chess come to be? How did you get into chess?
I watched the movie Searching for Bobby Fischer, and I started playing, but you were always better than me at it. And I would read books, and then you would read the book too, and then you would beat me still. And I spent a whole summer playing chess. That's all I did all summer. I went to a chess club, and I played in tournaments, and I got better and better. And I saw you in this summer, and then you beat me again.
I have no recollection of that
I
story
don't remember that
at all. No.
Yeah, I was so mad. I couldn't believe it. But then, I kept reading books and playing, and then finally I beat you one day. And it was like,
Yeah,
a
now
great
I
day.
now I have no chance. When I play you, it's no chance. I remember once you beat me blindfolded. Blindfold chess means when one person isn't looking at the board, you just tell them the numbers out loud, or the chess moves out loud. And I remember doing that, and you checkmated me in like less than 20 moves. So
Oh.
there you go. It comes full circle.
All right, yeah. If you
So-
stick with it, then anything's possible.
So keep working hard. It makes a difference. Ready for chocolate number 2?
Yes, that wasn't so bad actually. Wait, so what's the deal with the drinks? If we drink, do we get penalized?
No, the drinks are just there for your comfort. It just means you're a
Alright.
coward.
That last one was really spicy.
This one is called Very Hot. You ready?
I'm still kind of tingling from the last one.
You can eat as little or as much as you want. Again, never been tasted before. Here we go.
It's got a more strawberry taste to it.
I don't think it's much different.
Ah, it hit me.
Going for the water.
Told you I don't eat spicy food anymore.
Well, it is now application season for residency. You're a program director. I understand you have over 1,000 applicants for 50 interview spots for 3 categorical spots. What kind of things do you look for? What kind of things make you stand out from this pile of applications?
That's a great question. A lot of people think test scores and grades are the number one thing. The truth is, a lot of people's test scores and grades start to look the same. So I always want to find out, who are you as a person? So are you someone who has overcome adversity? Are you someone who looks to the other person and tries to help them? Or are you someone who tries to make others around you better? These are the kinds of things I look for first.
Well, along those lines, what would be something that doesn't tell you who you are? What's something that you see time and time again that just seems like this is a waste of an application?
I'd say in a person's personal statement, a lot of people talk about how they were inspired to become a surgeon, and they talk about what they saw and what it meant to them, but it doesn't really tell me much when you describe what inspired you in another person. I want to learn about you.
We're now at the halfway point. We finished 2 of the 4 chocolates. The third chocolate is called Insane.
I'm not doing so well.
All right, well, let's give it a try.
My heart's beating fast.
The Insane chocolate. I think I'm doing okay. Tom Kang here, really
so
coughed
good.
up a lung. Here we go.
When you first eat it, it's not that hot. Or this one doesn't taste hot at all right now.
I think they're mislabeled. I don't think that's hot at all.
Is that the mild one?
Well, Hot Monkey Bar, not too impressed with your Insane.
Okay, I can deal with that. My nose is running from that pink one, though.
A few years ago, you developed right upper quadrant pain after you ate fatty food. Now,
there's an aftertaste. There's a delayed response.
I'm not feeling the delayed response.
There's a delayed response.
Well, let me start again. Several years ago, you developed right upper quadrant pain after you ate fatty foods. And if you're in the medical field, you learn at an early stage that is a sure sign of
Gallbladder disease.
Now, how did you self-treat yourself knowing you are a gallbladder surgeon? And why did you treat it that way?
Well, the usual treatment for gallbladder disease is surgery, and we remove the person's gallbladder. It's very safe. We do it multiple times a day. A lot of people need their gallbladder out. It's not a big deal. But healthcare providers, for some reason, have complications. And that might be superstition, but I was really worried that as a surgeon, I'd be the one who'd have complications. I really was afraid to get surgery. Man, you went straight for the gallbladder story? My nose is running.
Well, you were saying, as a surgeon, the superstition is the healthcare providers are the ones that get the complications. So, no surgery. What did you do?
So I went on the gallbladder diet. So no fatty food. So I cut out cheeseburgers and pizza and cookies, but I would still hurt. So then I started cutting out red meat, but I would still hurt. So I cut out white meat, and I still hurt. And then I was just eating fish, but even that would make me hurt, so I cut out fish. And eventually I became vegan, except there's a smart way to be vegan and there's a dumb way to be vegan, and I picked the dumb way to be vegan, which is I just stopped eating stuff. And so I lost a ton of weight, and I was probably clinically malnourished, but my pain went away. So after 4 years of a strictly vegan diet, my symptoms went away.
Well, let that be a lesson to you. Instead of getting surgery, just don't eat for about 2 years.
4 years, actually.
4 years, and you don't need to get the gallbladder surgery. Well, we're up to the final piece of chocolate. I got this on Amazon, and it is called the world's spiciest chocolate. It's so spicy, they advise you don't take more than the tiniest piece. It's smaller than an Advil. Are you ready to do this?
No, but I'm still going to.
Here we go.
Oh, that's hot.
Is something wrong with me?
I mean, I've been... Maybe that's 4 years.
It's hot. It's hot.
I'm going for the milk.
Well, I guess I have finally found my hidden talent. I guess I can eat hot,
Oh
spicy
my gosh.
food.
Next question.
You've talked about the book Nick Saban's Leadership Lessons. How do you think this helps in building a residency program?
Nick Saban. Nick Saban, if you don't know, is the greatest college football coach of all time. The Coke's kind of helping.
Oh, good to know.
And probably the most important lesson is to have a clear vision and to make sure everyone buys into the vision and that you hold people accountable. Probably the most important thing is the program takes on the character of the leader. And what makes Nick Saban's teams great is that they capture all of his best qualities, like determination and tireless hard work and being obsessed with being prepared. So I always remember, set the vision, live it, and be a good role model.
So obviously the analogy can't be perfect. So what's something that maybe can't quite translate to running a multiple national championship football team with 280-pound offensive linemen versus a general surgery program with 125-pound surgical residents?
The biggest difference is in the game of football, there's a clear winner and a loser. There's a game, and at the end of the game, there's a result. And it's very clear. And so anything you do that contributes to that result is justified. Now, in the real world, like in medicine, there isn't a single game and there's not a single result. The wins are much more complicated. They're much more subtle. And so a lot of times, the means are not justified by the end. A win for one person might mean saving a patient. A win for another person might mean having a great work environment. For someone else, it's having time for their family. So the wins are much more variable.
Well, if looks like you're struggling, I do feel a little bit. I do have a little bit of a running in my nose, but I'm altogether unimpressed by the spicy chocolate. Maybe it's weird. I've always had a terrible sense of smell and taste. But that's the end of my first ever episode of Hot Doctors. Thank you, Dr. Tom Kang. Any last words into the camera?
I would say surgery is difficult. Becoming a surgeon is difficult. And when you succeed, it's a hard life. I think that's what Obi-Wan said to Anakin Skywalker.
You heard it here. You can't be a Jedi, but you can be a general surgeon. Take care. Follow me for more videos.